And good morning. Welcome to Talkback, the show that listens as we talk to you on Sunday morning. I'm your host, Larry Hall, and welcome to another edition of Talkback, the show that listens as we talk to you. Our number's 1-800-467-3699. If you're in Durham, 941-1071. If you're in Raleigh, 821-1043. Lots to talk about this morning. Everybody's excited about what's happening regarding state government and having a budget. Everybody's engaged on health care, what's happening there and how will it affect you. And then internationally, people want to know, will Israel bomb Palestine, and will they bomb Iran? Is Iran engaging with forces in Iraq? And what's happening with North Korea? All those questions out there. Finally, what about the U.S. Afghanistan policy from Iran to from Iraq to Afghanistan, troop movements, and we have evaluations that the U.S. should pull out of Iraq immediately because the mission is completed, and concentrate on Afghanistan, where we've had the highest casualty counts in our brief history there since we've engaged over the last 4 or 5 years. So 9 friendlies killed already this month. This is August 2nd, and so you can see that the activity has really picked up. What is the strategy going to be? And so with all these things on the plate, the question comes up, where are we in America today with the recovery of the economy? What about health care, that big elephant in the room that no one wants to talk about, but apparently everyone's talking about now? And what is the truth about what's going on with health care and with our health care system? So we're going to talk about those items and more. Again, our number, 1-800-467-3699, from Greensboro to Greenville, from Petersburg, Virginia, down to Dillon, South Carolina. We cover it all for you. We've got the reach, the breadth, the width, and hopefully the depth of your knowledge and participation in the discussion. And we're going to start out this morning. We've got 2 in-studio guests, the professorial ones, again. Professor Darrell Roberts didn't know I could use that word. Tony Powell, Professor Powell, neither one of them were ready for that. Both of them astounded that I could even pronounce it. Not on the academic level they are, but certainly been hanging around with them. Maybe it's rubbing off. Hopefully just the good stuff, not the bad stuff. And talking about academia in America, and gentlemen, as we come into it, I want to start off with you, Professor Powell, since you're on the mic and looking mighty dapper this morning. Always looking good for our radio audience. I've gotten so many compliments about your natty attire here on radio. And so I want to talk a little bit about what's happening in North Carolina. Seems there may be a budget in the offing, but at the same time, people still concerned about what's happening with education in North Carolina and other items. Where do you think we're going with that? I'll put in some perspectives as a legislator and talk a little bit about what we really see. But from the public's perspective, what do you see going on with our health care?
Well, in terms of health care, I think we're going to have to make some major decision. I know our president is touting his health care reform bill, but on the other side of that, you're dealing with issues in economics and the job well-being of those doctors that have gone to medical school. And for some of them, they can see the need for reform, but on the other hand, those doctors who oppose our president's health reform bill, and particularly in North Carolina, are those that are saying, look, give the people a choice, and the government cannot do a better job than what we are doing. And quite frankly, for those that have jobs and have money, then those individuals can pay for their health care. But if you look at the president bill, the president want to make sure that everyone will be insured with health care, which some people think that's the right thing to do. Others think otherwise. So in terms of our perspective, we have to take a look in terms of our budget and our figures.
Well, we've got a lot of people out now since Congress is out. in recess and back in the districts. A lot of people, for political reasons and otherwise, as we heard the statement made by Republican leadership, that if they were able to stop the progress on health care reform in America, then they could stop the Democratic Party and stop the president from being successful. And of course, that's the political side of it. Now, when we look at some of what people are saying when surveyed on a Consumer Reports survey, only 64% of the people who were in their survey responses said they were satisfied with their health care plan as it was. Now, these are people who are insured in a health care plan, and only 64% are satisfied anyway. So that leaves a big margin of people out there, 36%, about a third, more than a third, who are not satisfied, who have health care. And so obviously the millions, the 44 million, 45 million, ever how many million now it is, who don't have health care, surely they're dissatisfied with their health care plan. They don't have one. So the idea that people are putting forward that everyone is satisfied with what they have and there doesn't need to be any change from a satisfaction standpoint is statistically just not correct. And so needs to be a lot of discussion out there. We also heard that even the people who are in programs, healthcare programs, still have problems getting to see their doctors at about a 20% rate. They're saying that it's difficult or impossible to get to see their doctors even though they're in these existing healthcare plans. And again, so the idea comes out of whether or not it's really believable, the proposition that's being put forward by a lot of folks, that everyone who has health care is satisfied and we don't need to do anything to fix this system, when you only have 64% of the people saying they're somewhat satisfied. And even of that 64% of the people, they're saying that 20% of them say they have a problem getting to see a doctor at all, and that they're delayed in getting to see their doctor. So lots of things need to change besides just the price, but the accessibility, et cetera, are issues that folks have to work with, and we need to see some change. And certainly we can't keep doing what we've been doing, because the 44 million people continues to grow in America. Maybe up, my number may be off, that might be last year's number, but the number of people without health care continues to grow. The responsibility to treat them continues to be there, and if you keep doing what you've been doing, you'll keep getting what you've been getting. And we certainly don't want any more of the situations where we have people using emergency rooms to get their primary care and preventive care. We need to try to move on to some other method of treatment. And now I'm going to try to get you in here, Dr. Roberts, because I know you have a perspective on health care for America and for what's happening in different states, and certainly a lot of comparisons being made to Canada and made to European countries that have what some people call single provider or single payer systems. Certainly that is one of the sticking points in the Obama initiative, and I call it the Obama initiative. Is coming out of Congress, but the question of whether or not we're going to have some type of public source option, or public option as people call it, again, the framing of the issue may be people will call it government health care or other things, but at the same time, let's realize that the VA medical system is one of the highest rated in the world, and certainly the people who use that system appreciate it. And then you have the Medicaid system, and the Medicaid system, a lot of folks, Medicare, a lot of folks very satisfied with what it does. Some people not realizing that Medicare is run by the government. They get the discounts on the drugs and do the other things in both the Medicare and the VA systems that you will get from a public option or a public provider option. So we're already doing it successfully in two major areas, delivering a great volume of care, and people are highly satisfied with those two. So we know it can be done. All those naysayers out there, what about the misinformation that you're hearing in this discussion and how people are demagoguing the